Hi guys, I'm Lena. I'm a nurse, and I would like to introduce my new channel. It's basically for all nurses out there that have things to say and have things to talk about. And what's great about YouTube is that it's basically bringing everybody together. All kinds of nurses from all over the world will watch this, and we'll see what they do different. Because I feel there's a lot of international nurses in here in Toronto, and they are amazing because we learn so much from them. Whether it's practice, whether it's whether it's just best practice or how they deal with things. And sometimes it's a learning experience because as new nurses and as young nurses and as older nurses, sometimes we have ways of approaching people and things. And I don't feel like there's one way that we can approach a family or a patient, because everybody here, especially in Toronto, and I don't think I can live anywhere right now. There's only one kind of race. I feel like I want all those races because I want to learn from all of them, and I feel like it creates such a great variety and makes the nurse, so versatile and so mendable. And I want to talk about all these things. I want to talk about the ethical issues that we go through as nurses, and I want to talk about grieving as a nurse because we're taught certain ways of like we have to we have to like create this boundary, and we have to create this we can't feel. And I think it's all sometimes wrong. I feel like we're feeling, breathing human beings, and we're women, most of us, some of us actually, I shouldn't say that. There's nurses too, which I love. And I want to talk about these things. I want to talk about relationships with a nurse, and my experiences with boys that are not familiar with nurses, and just things like that, because I feel like sometimes you know um we date people or whatever, but sometimes they're not the best match. And I feel like a part of it why is because once I left nursing school, um I just changed as a person. My outlook on life changed. My priorities in life changed, and I'm thankful for for very many things that are most people are just taking for granted. And if you were a patient and have had a good or bad experience with a nurse, specifically with a nurse, let me know, because I feel like you know um, there's good practice and there's bad practice out there, and we as nurses need to really admit that, because I've had some horror stories and I've seen some horror stories. And what do I do when I see something like that? Do I step in? Is that my place to step in? So all these things like that, come into practice, and just working with mainly women sometimes on the floor. I guess I wish we had more male nurses, because I feel like it would create that balance, because there's all these controversies, and and then there's a nurse physician relationship, and we can all have fun commenting on that one. And there's all these things, and I want to start talking about these things because I feel like it'll give the patient a better understanding of what goes on with nurses, and really what goes on behind the scene, and what goes on to help you achieve your goals as a patient, and how we deal with different elements of our work, and what theories that come into play, and do we even use theories in our practice that we're taught in school. And this is great for nursing students, because I feel like it prepares you for what's going on outside the workforce, because even if you do your clinical, you do not see everything. And I feel like only when I started working I realized the big picture, and we'll kind of paint that big picture together, together as we go through this journey. And I think it's a good channel. And if you guys want some skills shown, I'll help you. But I feel like skills are everywhere in books and on the internet. And each facility has policies and procedures for that. And I can't show you one way and tell you that it's right and have you go messed up on your test. So I don't know. Every hospital and every school has best practice, and they have those little things that are different. But I think all of them work, considering we all practice safely. And we're going to talk about wound care. We're going to talk about the elderly population. We're going to talk about horrors of the emergency room, horrors of the OR, and things that go wrong, and ethical issues that I really can't tell you how many, and how we deal with them. I know as patients and as nurses, and we can switch shoes sometimes, maybe, and I become a patient, and how would I react versus me as a nurse, and just things like that are where I want to talk about. So I won't promise that I'll post a video every week, but I want to talk about substance things, and I don't know how receptive everybody's going to be of this video and this idea, but I hope that we can talk about it, and you guys can even post videos and just share your opinions, and we'll go from there. And if you don't like my channel, then I'm sorry. Okay? Take care.